Hello, today I will be explaining how to properly use a cold and hot compress. These are for the individual usages of a cold or hot compress, not together. Consult a professional to use both as it is done in a specific way. If done improperly, it can lead and result in further damage. So for the first explanation will be how to use a cold compress. The materials you will need are a variation of an ice pack. Some are fast and ready, such as these ones where you crack and shake the bag, or a simple plastic bag filled with ice, and a lightweight semi-thick towel. Here's an overview of needed materials. Examples of injuries you may use a cold compress for are reducing pain and swelling or inflammation when an abrupt injury occurs. Now to begin, you will want to locate your injury site, and depending on where your injury is, either take a seat or lay down. Now with working with the cold compress, you will want to place a towel onto the injury site, then place the ice pack on top. You will now want to start applying a comfortable amount of pressure by holding down the ice pack or wrapping it with an ACE bandage. While icing about 10 minutes in, you will want to check for capillary refill. During this small test, you are looking for the color on the palm side of the finger to quickly come back. If it takes longer than 5 to 10 seconds, then the ice is too cold or too tightly wrapped. If the color takes too long to come back, simply remove the ice. It is important to remove the ice if capillary refill takes too long to come back or if discomfort persists, as having the ice too cold can lead to cold-induced vasoconstriction, which is the narrowing of blood vessels that inhibits blood flow and can lead to damage. You will want to leave the ice on for 20 minutes, and when time is up, remove it, then rest for 30 minutes. Next, try to move the injured area, however, do not force any sort of movement. This concludes on how to properly use an ice compress. Remember to pay attention to your injured location for the remainder of the day and take note of any pain or discomfort. If necessary, repeat steps when felt is needed and consult a doctor if symptoms persist. Now I will explain the hot compress. To begin, you will want to gather your materials, which includes 2 towels. One may be used as an alternative hot compress by either pouring hot water on top or soaking it and heating it in a microwave. Or you may also use an electric heating pad, all depending on your preference or what you have available. Make sure to have at least one dry towel to go onto the skin. And lastly, find a location to sit or lay down. Here is an overview of your needed materials. Examples of when to use a hot compress are muscle spasms or aches, soreness, cramps, tension, or joint pain. It is important to note that you do not use heat on bruises, swollen areas, or open wounds. Now you will first locate your injury and either take a seat or lay down. Before beginning the steps of using the hot compress, if you suffer from nerve damage or have pre-existing health problems, it is important to take extra precautions, such as an extra layer of a dry towel under the compress or having the compress on for a less amount of time. Now start by placing one of the 2 dry towels on top of the injury site. Slowly you will rest the heating alternative of your choice on top of the towel. Once comfortable, apply a small amount of pressure if felt necessary. You will leave the hot compress on for 15 minutes and rest for 30 minutes at a time. Remember to discontinue use if the skin becomes painful or inflamed. Once you finish your cycles of compress and rest, remove all heat from injury and slowly begin to move injury site, however, do not force any sort of movement. This concludes the individual usage of a hot compress. Similar to the last step of the cold compress, pay attention to the injured location for the remainder of the day, and take note of any pain or discomfort. If necessary, repeat steps when felt is needed. To conclude, consult a doctor if symptoms persist or pain increases. These 2 methods will not completely heal a serious injury. It is important to not rely on icing or heat compresses as they are more of a temporary pain reliever. Your recovery time will depend on the severity of the injury. A small inflammation or muscle ache will heal with these methods. However, a serious injury such as a sprain or back muscle tension may not heal but will be relieved. Thank you.